Good evening, everyone, and welcome. We are so excited to have you here at our webinar. This is such an important topic because it gets talked a lot about in our support groups, and we always want to continue the conversation. So our first bit tonight is that obviously this cannot be taken as medical advice, and we're not endorsing any treatment, product, or course of action. You should always consult your doctor about a specific situation before pursuing any health program or treatment. And of course, we want to give a big thank you to our sponsors, Pfizer Oncology, Bayer, Advanced Accelerator Applications, Foundation Medicine, and the Active Surveiller. But first of all, if you've gone to our caregivers group, you might know our next guest super well, but if you haven't, you should absolutely check out our caregivers group. Or if you have a caregiver, feel free to share our group. Someone who's amazing to Ann Can, she is on our advisory board and is a woman of many talents. Wendy Garvin-Mayo, thank you so much.
Thank you for having me. I'm so excited to be here. Welcome, everyone. My name is Wendy Garvin-Mayo. I will be your moderator tonight. And tonight we are talking about optimizing sleep, exercise, and nutrition in prostate cancer. These topics all align with physical wellness that all of us can benefit from finding out. So I want you to really take out your pens, take out your paper so you could take some notes, because there's going to be some great information shared here with you tonight. If you have questions throughout the presentation, please put them in the chat, and at the end of the presentation, we will go into a Q&A session. Thank you so much for being here, and I am going to pass it on to Howard Walensky to introduce our presenters.
Okay, again, welcome everyone. And I suspect that most of us ask our urologist the following question after we're diagnosed with prostate cancer. Sorry. The question is, are there changes to my lifestyle, such as diet and exercise, that I can make to improve my odds with prostate cancer? Typically, we're told there is no prostate diet. Just follow a healthy heart diet like the Mediterranean diet, shoot for overall good health, and keep your weight down. Well, we may hear a different story tonight from our speakers, Dr. Stacy Loeb and Justin Gregg. And I'll give you a little background on them. We're especially grateful that they came to join us. Dr. Loeb is a professor of urology and population health at NYU Langone and Manhattan VA. She specializes in prostate cancer. She will be speaking tonight about her research on diet, sleep, and exercise, and prostate cancer. Dr. Loeb completed her urology residency training at Johns Hopkins and her MD at Northwestern here in Chicago. She received a grant from the NCI, National Cancer Institute, to study active surveillance for prostate cancer. She's also well known as the host of Men's Health Show on Sirius XM, and a couple of her fans are in the audience. Now, we also have Dr. Justin Gregg, who's an assistant professor at the Department of Urology, Division of Surgery at the University of Texas MD Anderson Cancer Center in Houston. He received his MD from Vanderbilt University School of Medicine in Nashville, and did his residency there, and did his fellowship in urologic oncology at the University of Texas MD Anderson Cancer Center. Justin will be discussing his research on diet and prostate cancer tonight. His research on Mediterranean diet and prostate cancer made big headlines last year, but he'll be speaking about more than that. So I turn the podium back over to Wendy.
Thank you so much, Howard. I appreciate that. So now we're going to get started with Dr. Stacy Loeb, who will be talking about her research on diet, sleep, and exercise in prostate cancer. Dr. Loeb, turn it over to you.
Hi, everybody. Thank you so much for having me on. I'm just going to share my screen. Hopefully everyone can see that now. Okay, so today we'll be talking about optimizing sleep, exercise, and nutrition in prostate cancer. We'll start out with sleep health. So I guess first, ask yourself these questions. Do you have trouble falling asleep or staying asleep? Do you wake up more than once in the middle of the night? Do you snore? Do you wake up choking or gasping? Do you feel fatigued during the day? How likely are you to doze off in the middle of a meeting, in a public place, or even while you're driving? Or do you have any of these risk factors? Are you overweight? Is your shirt collar larger than 17 inches? Do you have high blood pressure? These are risk factors for sleep apnea. So if you said yes to any of those, you're certainly not alone. Sleep problems are extremely common in the US and extremely common in prostate cancer. There's many different types of sleep problems. Common problems include insomnia, which is difficulty falling asleep, staying asleep, or waking up too early and unable to get back to sleep. Sleep apnea is another common condition which can be potentially serious, where breathing actually starts and stops. And there's a whole variety of other sleep problems, many of which are less common, such as narcolepsy, restless legs, etc. So sleep problems are definitely more common in prostate cancer, and one reason could be because it seems that sleep disturbances actually increase the risk of prostate cancer. So this is a very interesting systematic review of all the studies related to sleep in one fashion or another with prostate cancer risk. And no matter how you look at it, whether it's countries that have more light at night, people who do shift work, or pilots with circadian disruption, or people who have less duration of sleep. Each of those are associated with an increased risk of prostate cancer. So 15 out of the 16 studies had a positive association between sleep disturbances. So why are sleep disturbances linked with prostate cancer or cancer in general? Well, for one thing, the circadian system is a potential tumor suppressor. It may actually inhibit cellular proliferation, angiogenesis, etc. Also, melatonin, which peaks at night, inhibits prostate cancer growth in experimental studies. And then also, obstructive sleep apnea leads to hypoxia or lower levels of oxygen, which can accelerate tumor progression. So many different ways that sleep disturbances can be linked to prostate cancer risk. Now, how about people who already have prostate cancer? Well, we just published a systematic review on this. We looked at 83 different studies of people with prostate cancer, and 3 also included caregivers or family members of people with prostate cancer. And the bottom line is prostate cancer has a substantial impact on sleep. And it can be for many reasons. It can be linked with a lot of other issues like night sweats, urination during the nighttime, pain, stress, and anxiety. Any of these things can lead to further disruptions in sleep. This is a recent survey that we just finished. This is with patients with prostate cancer, asking using a variety of different sleep questionnaires, how common are these issues? And you could see if you are experiencing sleep disturbances, you are very much not alone, because actually 67% of the patients in our survey had poor quality sleep. Now, another concerning finding is that 45% had those risk factors where they were actually at high risk for sleep apnea, but very few had actually been formally diagnosed. So if you are having symptoms like choking or gasping, snoring, it is really important to see a sleep specialist. We also found that 48% were using sleeping medicine, which is a very high number. So sleeping medicines do have many potential risks. So it's definitely important for everyone to know that there are other options. This is another study. This is a slide from Dr. Lorelei Mucci, who runs the Ironman registry. This is a registry of patients with metastatic prostate cancer. And you can see that they asked a few questions about sleep. They asked, how often do you have difficulty falling asleep? And about half of these patients had difficulty falling asleep either most of the time or sometimes. They also asked, how often do you feel really rested when you wake up? And about half of the people said never, rarely, or sometimes. So this is really, a big issue for sure. And, importantly, this affects not only patients, but also their family caregivers or partners, particularly bed partners. And in fact, this is a survey that we just had accepted for publication, including family caregivers of patients with prostate cancer. And actually 88% reported poor quality sleep. And 43% of the family caregivers were using medications to help them sleep. So these issues are very important to all members of the family during the prostate cancer journey. So why do we care about this? First of all, sleep disturbances are very morbid. It certainly leads to depression and less feeling of well-being when you don't get enough sleep. But it also increases the risk of multiple diseases, including things like blood pressure, diabetes, cardiovascular disease, obesity. We tend to eat more and less carefully if you're sleep deprived. And then, other things like accidents and injuries are more likely with sleep deprivation and increased healthcare utilization. So what to do about this? Well, first and foremost is improving sleep hygiene. Mindfulness meditation. This can be very, very helpful for people with prostate cancer, and I highly recommend it. There are apps, there are many online programs, and doing this can really be helpful in the evening. You could even go a step further and do cognitive behavioral therapy for insomnia. This is considered a first-line therapy. Sleep medications are there, but I would definitely exercise caution. They should be used in the short term to get through specific issues and are not recommended for long-term use. And seeing a sleep specialist. If this is a big problem for you, then definitely get help, and especially if you're having symptoms that are possible for sleep apnea. Sleep hygiene. So here's some tips for what you should do to try to maximize your space and your behavior. So first of all, it's nice to have regular bedtime and wake up time. Bright light is great in the morning, but you want to avoid it at night. So you don't want to be looking at electronics at night or looking at the phone or the clock when you wake up in the middle of the night. Physical activity is great, but again, best if it's in the morning or the afternoon. You want to really limit caffeine, and especially not having it at night. Big meals or lots of fluid within a few hours of bedtime are going to make it more likely that you have to wake up to go to the bathroom. I always tell my patients that when the lights turn off, the kidneys do not turn off. So we still have to, not drink a lot before bed if we don't want to wake up. And enhancing the sleep environment. If it's too hot, not comfortable, then do what you can to get the temperature and the comfort right. Now, here are the guidelines for insomnia disorder. And actually, as you see here, cognitive behavioral therapy for insomnia is the recommended first line. And then shared decision making can be used about adding a sleep medication in the short term if that's not enough. And of course, we're never going to solve this problem unless we treat secondary causes of insomnia. So if you are having another issue that is contributing to the insomnia, which includes things like depression, pain, urinary problems, or a sleep disorder like sleep apnea, without treating it, it's not going to get better. Cognitive behavioral therapy for insomnia. This is available as an individual or a group therapy if you want to actually see someone, or if you want to do this on your own, there are self-help books. There's an app, for example, the VA healthcare system has a free app that you can download that's shown here, the CBTI Coach. And just beware, sleep medications can be helpful in the short term to get through a rough patch or for specific events or international travel, but are not intended for long-term use, and there are black box warnings on multiple of the medications. So again, just to summarize, and this is right from the National Comprehensive Cancer Network guidelines, they discuss the importance of stimulus control. The bed is for sleep and sex. You don't want to have too many, long daytime naps. Trying things like cognitive therapy or relaxation training can be very helpful. Okay, so moving on next to lifestyle modification, including physical activity and nutrition. I think this is so important for people with prostate cancer. And the reason is because if you have low risk prostate cancer, you are at least 9 times more likely to die from cardiovascular disease than from prostate cancer. So we should be addressing cardiovascular risk factors or healthy heart. And the good news is what's healthy for the prostate is also healthy for the heart. So we have the same exact recommendations, which is so great. There's the miracle cure is really a miracle for everything, and that's nutrition, exercise, and sleep. And for patients at the other end of the spectrum with metastatic prostate cancer, still 17% of patients with metastatic prostate cancer die from non-cancer causes, of which cardiovascular is the leading cause. So here's what the American Cancer Society survivorship guidelines recommend: maintaining a healthy weight, engaging in at least 150 minutes a week of physical activity, eating a diet high in fruits, vegetables, and whole grains, and avoid smoking. And this is the same as the physical activity guidelines for Americans. So this applies to everyone in the family. So everyone should be doing at least 150 minutes a week of moderate intensity physical activity. Now, what if you don't have time? Just start with 5 minutes. It all adds up. What if you like higher intensity activity? Well, that's okay too. So if you're going to do vigorous intensity activity, then at least 75 minutes a week. And in addition to the aerobic activity, it's also important to do muscle strengthening exercises at least 2 days a week. And this is anything that makes your muscles work more than usual. So the key is really just look for activities that you enjoy, and hopefully everyone can find something on this list or something in their life to get active. Maybe it's gardening, maybe it's dancing, maybe it's tennis or jump rope. It really doesn't matter. So just figure out what program works for you or how to incorporate it in. Ever since the pandemic, I've been cycling to and from work, and that's a nice way to, active transportation and also getting some physical activity along the way. Strength training, very straightforward. Resistance bands are very cheap. You could take them anywhere with you in a bag, so they're great. If you do have weights, that's great, but you can also just do body weight exercises or just use things around the house. I didn't have any weights in the house when the pandemic started, so I was using, bottles of liquid as arm weights for doing resistance training. So you don't need any fancy equipment to make this possible. And then, of course, it's also really important to incorporate some flexibility and mind-body, things like yoga and mindfulness meditation. This is a systematic review of exercise for people with prostate cancer. This study only looked at randomized controlled trials, but they did include 16 different studies. In this particular systematic review, they didn't find any difference in disease progression across all of the studies. However, they did find that exercise had many other benefits. It improved cancer-specific quality of life, it reduced fatigue, it led to increases in sexual activity, better body strength, and more aerobic fitness. So lots to gain. But other studies have shown benefits for both the cancer as well as overall cardiovascular fitness. I know that Dr. Kernia recently presented for this group, and he's done some fantastic work, including this trial, the ERASE study. This is patients with low-risk prostate cancer who were undertaking active surveillance. They were randomized, or that is, they were randomly assigned either to participate in high-intensity interval training 3 times a week for 12 weeks, or they were randomly assigned to just usual care without the exercise program. And they found that the people who did the high-intensity interval training had better cardiopulmonary fitness, but also a decreased PSA. And here's another study that did show a decreased risk of progression. In this case, this is from Capture. This is a large database of patients from around the country with prostate cancer. And those who walk briskly for more than 3 hours a week did have a lower risk of progression. Here's another study that examined physical activity after prostate cancer diagnosis. And again, doing more total activity, non-vigorous or walking was associated with more vitality and less symptoms. So lots to gain, nothing to lose. Nutrition, this is the last topic I'll discuss. So as you all probably know, prostate cancer incidence varies quite a bit across the globe. You can see the dark regions on this map are the highest risk areas in the world for prostate cancer. So you can see us here in the US, as well as, Canada, Australia, Northern Europe. Now, what's very interesting is that if you start out in a low-risk country, for example, Japan, and you move to the United States, your risk of prostate cancer is actually higher. So something about moving from Japan to the US, that is starting the standard American diet, or SAD as it's known, is associated with increasing the risk of prostate cancer. So what is different about the diet in these countries? So I took the prostate cancer incidence map that I showed you before, and now you can see over to the right, you could see per capita milk consumption is the graph on the top, and the dark blue are the highest milk consumption. And basically, Northern Europe, America, Australia, same places have the highest milk consumption. The bottom map is meat consumption, and you can see again, places like America, Australia have the highest meat consumption, whereas Japan, the low-risk country, has much lower intake of these foods. So we already know about a lot of individual foods, and many of you may have heard, for example, that things like tomatoes, which contain lycopene, are beneficial for the prostate. Also cruciferous vegetables, and this is a big family with lots of very tasty vegetable options, very good for the prostate. Nuts, another food that's good for the prostate. Whereas some other foods are thought to be harmful for the prostate, and this includes dairy and red and processed meat. So I'm not sure how many people know this because I only found this out a couple of years ago myself. But the World Health Organization actually considers processed meats. This is things like hot dogs, sausage, bacon, deli meats like salami as a group 1 carcinogen, which means causes cancer in humans. This is actually the same category as substances like arsenic and asbestos. Now, other types of meats, such as beef, pork, and lamb, are in group 2A, probably causes cancer. And this is the same category as DDT, lead, and mustard gas. Why there isn't a big label on all of these foods in the grocery store, I think is because of the very strong lobbying of these industries, but I think it should be because it's really scary that people don't know about this, and really nobody should be eating processed meat. Certainly not people with prostate cancer, but there's no benefit to this food. Why is meat carcinogenic? First of all, there's the formation of heterocyclic amines, or these cancer-causing substances during high temperature cooking. There's also hormonal effects, and even just the innate nutrient composition is just less healthy. There's lower levels of anti-carcinogenic compounds like antioxidants and fiber in meats compared to plant foods. Maybe some of you saw this in the New York Post. This is a study saying eating 1 hot dog takes 35 minutes off of life. So again, no reason for anybody to consume processed meats. So what happens then if you remove these harmful foods from the diet, like meat and dairy, and you keep the beneficial foods? What you're left with is really what is known as either a Mediterranean or a plant-based dietary pattern, which are very similar. It's just a Mediterranean diet would include things like fish, whereas the plant-based dietary pattern would focus on plants, but they're largely very similar. I personally am a big proponent of a whole foods plant-based diet, or WFPB. Now, this does not mean Whole Foods, the grocery store. This means whole foods, or whole minimally processed foods. You should be buying most of the food in the grocery store from the produce section. It should not be in a plastic package. Anything that is in a package or has a long list of ingredients means that it is more processed. So we want to avoid things like simple sugars and white bread and white rice, but we don't have to be afraid of carbohydrates. Things like whole grains have lots of fiber and are very healthy, and fruits and vegetables and legumes. There's many benefits to plant-based diets. First of all, they've been shown to reduce the risk of many health conditions: heart disease, diabetes, high blood pressure, multiple types of cancer, and certainly obesity. They're also more environmentally sustainable, and it's good for the animals. 72 billion land animals and 1.2 trillion aquatic animals are killed for food every year. Plant-based diets are also healthy. In fact, this is a position paper of the Academy of Nutrition and Dietetics, and they discuss how appropriately planned vegetarian and vegan diets are healthful, adequate, and may even provide health benefits for prevention and treatment of diseases. They're appropriate for all stages of the life cycle, are more environmentally sustainable, and are associated with reduced risk of heart disease, diabetes, hypertension, cancer, and obesity. So right from the Nutrition and Dietetics Association. But we're here today to talk about prostate cancer. So what about plant-based dietary patterns in prostate cancer? Well, the good news is, like I said, what's good for the heart is also good for the prostate, and there's really benefits across the whole spectrum of disease. And so a lower risk of having an elevated PSA with plant-based diets, a lower risk of diagnosis with aggressive prostate cancer, a lower risk of progression in men with low risk prostate cancer on active surveillance, and a lower risk of progression among men with recurrent or advanced disease. So really, from the beginning to the end, there's benefits. So let's start with elevated PSA. This is a study that came out in 2021. They looked at data from the National Health and Nutrition Examination Survey and showed that higher consumption of healthy plant-based food was associated with a lower probability of having an elevated PSA in the first place. We followed up on this by looking at more than 47,000 men in the health professionals follow-up study. This is a very large study out of Harvard, and found that greater consumption of plant-based food was associated with a significantly lower risk of fatal prostate cancer. Now, for patients who are on active surveillance for favorable or low-risk prostate cancer, this is a randomized trial. This was done by Dr. Dean Ornish and colleagues at the University of California, San Francisco. Here, the patients were randomly assigned either to participate in the lifestyle program, where they did a vegan diet with physical activity, stress management, and supplements, compared to controls who were assigned not to participate in the lifestyle program. And the diet, exercise, stress reduction program, fewer progressed to treatment, their PSA was significantly lower, their cholesterol literally plummeted, just dramatic reduction. And interestingly, 95% of the people were still adhering with the diet a few years in. So it was not something that was aspirational, it was very much possible. Now, here's a different context. This study out of UC San Diego, the Healthy Men study, looked at patients who already had treatment, either with surgery or radiation. And they found that doing plant-based diet with stress reduction, before they started the diets, the PSA was rising. When they first started the diets and were very adherent, the PSAs actually declined. And then after that, when the compliance with the diet was less, the PSA did go up, but still at a lower rate than before they started at all. So it really, did have the potential to help stabilize the disease. And finally, interesting but very small study of patients with metastatic prostate cancer who were adopted a macrobiotic plant-based diet compared to controls on the SAD, or the standard American diet. And the patients who were on the plant-based diet had a longer median survival, and a few of them, were able to delay their disease progression while they were adherent to the diet. What are the downsides? Actually, there aren't any. It's just a win-win. And you get some bonuses too. An added perk of plant-based diets is better erections. The same group that looked at elevated PSA is lower in plant-based diets, also found that healthy plant-based diets were associated with a lower risk of erectile dysfunction. And we just published very similar results in the Health Professionals Follow-Up Study, which is that same large study out of Harvard University, where people who consume more healthy plant-based foods, which is fruits, vegetables, whole grains, and legumes, or the whole foods plant-based diet, had a lower risk of erectile dysfunction. Another added perk is improving diabetes. I thought I should mention this because this just was published last week. It's a new consensus statement from the American College of Lifestyle Medicine. It was endorsed by several other societies as well. But they basically discussed how diet can be used as a way to achieve remission of diabetes, emphasizing this whole plant-based foods with minimal consumption of meat and other animal products. And they do caution that doing a very low carbohydrate diet can be associated with significant adverse events and cardiovascular risk. So instead, trying something like a keto diet for diabetes could have short-term gain, but significant long-term risk. And finally, an added perk to plant-based diets is weight loss. This is an interesting study where people were randomly assigned to do either a Mediterranean or a vegan diet for 16 weeks, and then they switched diets, and they found that both lost weight. So you could lose weight with the Mediterranean or the vegan diet, but the vegan diet had more weight loss and more reduction in cholesterol. So if you find this interesting or want to learn more or try to eat more plant-based foods, maybe take a picture of this slide, but there's like so many great resources out there. So I just want to share a few with you. Documentaries, Game Changers was just fantastic, especially for athletes. Forks Over Knives and What the Health are real eye-openers. In terms of books, my parents both adopted plant-based diets based on How Not to Die by Dr. Gregg, as well as several of the other urologists in my department. So that book really is very well done, and I highly recommend it. The China Study is another classic book by Dr. Campbell. Another really interesting book is Healthy at Last by our New York City Mayor, Eric Adams, who completely reversed his diabetes with a whole foods plant-based diet. There's also a lot of great information online, recipes from physicians and registered dietitians. I particularly recommend the Physicians Committee for Responsible Medicine website, or PCRM, and also nutritionfacts.org. If you're looking for a meal service in the US, Purple Carrot has boxes to help learn how to prepare plant-based foods, and Happy Cow is a great website and app to help find plant-based food wherever you are in the world. I went to Mexico, I went to Sweden, and I was able to find food, tons of options right near my hotel. So it is absolutely possible, and I wouldn't recommend anything to you that I don't do. I exercise 7 days a week, and I follow a plant-based diet, and so I'm a true believer, and I hope that this is helpful. So in conclusion, eat more plants, because plant-based diets are associated with a lower risk of prostate cancer progression. They're also better for cardiovascular health, sexual health, the environment, animals, basically everything. So it's a win-win. There's really no downside, but you want to emphasize whole, minimally processed foods. So, you know, stuff that is not in a plastic wrapper. Also, so important to get active. Everybody should be doing at least 150 minutes a week of moderate intensity physical activity. Also important to incorporate strength and flexibility exercises at least 2 days a week. And this may reduce prostate cancer progression, but certainly improves quality of life and cardiovascular health. And then don't forget about sleep. It just somehow never gets brought up, but it's just so important for physical health, mental health. Make sure you've improved your sleep hygiene, you know, set yourself up for success. If you haven't tried cognitive behavioral therapy for insomnia, you can see someone, try the app or websites. And then if you're having difficulties, you can see a sleep specialist. I'd like to acknowledge all of our grant support, as well as the patients, caregivers, and healthcare providers who participated in our studies. And I want to close by announcing a new study that we just opened this week. And it's open for people with prostate cancer or partners or family members. This is the Sleep Health and Improvement Program. So together with some wonderful colleagues from Harvard and University of California, San Francisco, we created a website with recommendations on sleep, nutrition, and exercise. So we're looking for people to participate in a pilot study to see if the website is helpful. So this involves completing surveys, wearing a wristwatch to measure activity for 2 weeks, visiting the website, and 2 telephone calls with the study team. And gift cards will be provided as reimbursement. So if anyone is interested in learning more about it or scheduling an interview, I put the contact information for our team at the bottom. You can call or email to Natalia Byrne or Tatiana Sanchez Nolasco, and we look forward to hearing from you. So thank you, and I'll turn it over to Dr. Gregg.
Thank you so much, Dr. Stacy Loeb. That was such a great presentation. Your wrap-up was really SAP. That's what I took from it. Sleep, get active, and plant-based. Thank you so much. So now we're going to turn it over to Dr. Justin Gregg, who is going to present on his research on Mediterranean diets and prostate cancer. Dr. Gregg, turn it over to you.
Great. Well, thank you guys so much. I'm really honored to be talking with you. And the hardest part, I guess, is following Dr. Loeb's tremendous talk. So I'm really happy to show you some of our work and some of the research in this space as well. This is my disclosure. It's not relevant for this talk. I'm part of a steering committee for Bayer Healthcare. So the objective here is to go over potentially modifiable risk factors, really building on what Dr. Loeb told you about and highlighting a few other areas that are potentially modifiable. And we'll look at different spaces. One is being at risk of prostate cancer, those who've been diagnosed with maybe a low-risk disease on surveillance, and those with more advanced disease. So jumping right in and starting off with prostate cancer risk, what I'd refer you to if you're very interested in this space is looking at the American Institute for Cancer Research. They publish this update about every 5 years or so of factors that are associated with prostate cancer diagnosis. This is their main summary slide. It's a very busy slide, but what I'll show you is on the right side is the probable factors associated with prostate cancer or more aggressive disease being diagnosed, and that's body fat and adult height. And there are some other factors that are not quite as rigorously studied, but things like dairy intake or low intake of things like alpha tocopherol. And we'll go through here, is like Dr. Loeb mentioned, some meta-analyses where they take a number of studies and they summarize the data to try to give us some sense as to true associations that are here. So what we're looking at is a plot of a meta-analysis of patients' BMI and being diagnosed with cancer. What you can see is this vertical line would be a study showing that there's no association between BMI and diagnosis. And this small diamond at the bottom shows that it's to the right of the line, meaning that as BMI goes up, there's a higher risk of being diagnosed with prostate cancer. Now, we all probably know that there are limitations to measuring BMI. So something like a waist-to-hip ratio that's more associated with things like visceral fat is also associated with prostate cancer diagnosis. Now, importantly, a number of patients who are diagnosed with prostate cancer have factors that are associated with the metabolic syndrome. I list the 5 factors here. The metabolic syndrome is a clinical diagnosis where if you have 3 of these 5 factors, you're diagnosed as having the metabolic syndrome. And what's been shown is that metabolic syndrome is associated with prostate cancer diagnosis. But I think perhaps more importantly, when they look at patients who are diagnosed with truly more aggressive prostate cancer, there appears to be an even stronger association between metabolic syndrome and being diagnosed. And Dr. Loeb already went over these data in detail. Physical activity, there's not quite as much evidence as things like BMI or waist-to-hip ratio, though being more active is actually associated with a lower risk of diagnosis. And going a bit deeper into diet, this is a study that looks not just at a meta-analysis focused on things like randomized trials, but really summarizing the evidence of dietary factors. And the main points they made were that things like dairy intake, fish intake, and tomato intake seem to be associated with prostate cancer risk, with dairy being higher, fish and tomatoes being lower. And what this really jumps out to me as something that Dr. Loeb also mentioned, it's very consistent with the Mediterranean diet. And in fact, there's this growing body of evidence that a Mediterranean diet may be really helpful for patients who are at risk or diagnosed with prostate cancer. This is an older meta-analysis which showed that Mediterranean diet may be associated with a lower lower risk of diagnosis. Moving on to other factors, there's a number of studies that have looked at statin use and the prevention of prostate cancer. And to summarize the evidence, those who take statins may be at a lower risk of being diagnosed with the disease, and we'll talk later about how they may have a lower risk of dying of prostate cancer. Now, there's interesting is there are multiple mechanisms at play here. Of course, we all know that statins are good for the heart, they lower cholesterol, but there are also factors that are not related to cholesterol in which statins may be working. And I find this just a very interesting table that was summarized by these authors. As we know, in the early 90s, death from prostate cancer was essentially peaking, and it's had a steady decline. But at the same time, as you can see in this orange line, there's been a steady decline in the US cholesterol levels, as you can see in the blue with the increased use of statins. So this is purely high-level epidemiologic evidence, but there is that possibility that the increased use of statins in our country has led to decreased risk of prostate cancer and death. Now, for time reasons, I can't go over some other modifiable risk factors, but those are listed here, and I'd encourage you to look at those on your own. Now, in terms of progression among men who've already been diagnosed, this is a study that really summarizes the literature of dietary factors among those patients who've had a diagnosis of prostate cancer. It's focusing on randomized trials. This table really summarizes those results. The strongest results, again, are things related to things like inflammation or the Mediterranean diet, tomatoes, green tea. Then there's some other factors that have slightly lower evidence, but may offer potential benefit, things like avoiding dairy or consuming coffee. Now let's look a bit at really the most powerful study we have so far, though it clearly does have some limitations. And this is a study that many of you may have participated in. It's called the MEAL study. This is a randomized trial looking at increasing vegetable intake among men on active surveillance, those who were diagnosed with prostate cancer and being actively watched. It's a telephone-based intervention. They had a composite endpoint looking at progression based on blood tests or biopsies. What they showed, they did successfully randomize men on this study, and they improved vegetable intake, though they did not improve it to the level that they really set out to do. And I think it is important to note this was looking just at vegetables. The rest of the diet, dairy, meat intake, any other factors were not changed. Now, as you probably know, this was a negative study. It did not meet its endpoint. On the top graph, you can see the composite endpoint where the two lines are almost overlapping, so there was no difference in progression. And then for biopsy-based progression, which is the lower graph, there actually were fewer events than you would expect, but there was no difference between these groups. So I think the authors did a tremendous job here, and this does not completely discount plants, and I would never say that in front of Dr. Loeb, but I think that there is a big picture here. Doing an intervention for a single dietary component probably isn't the answer for those who've been diagnosed with prostate cancer. So we set out with the hypothesis that it was overall diet quality that may be associated with progression among men who are on active surveillance. And we focused on the Mediterranean diet. And just for clarity, I know we've talked a lot about diets tonight. These are the factors that are really looked at and considered for the Mediterranean diet. So it's eating certain things like vegetables, fruits, legumes, but also avoidance of things like meat, dairy, and alcohol is allowed in some moderation, particularly red wine. So we looked at this at our MD Anderson active surveillance cohort, over 400 men who had a baseline biopsy and a confirmatory biopsy, and looked at rates of progression. This is a busy table summarizing our results. What we essentially did was broke these men into three groups, those with the lowest adherence to Mediterranean diet, the middle, and the highest. And those with the highest adherence when compared to the lowest adherence seemed to have a lower risk of progression over time. And this was consistent across a wide variety of patient groups, which is shown here. So moving on, I know we've talked a good amount about diet. This is actually a study that Dr. Loeb went over by Dr. Corneo, which is really tremendous, looking at high intensity interval training. So I won't spend too much time here. But when we think about men who've been diagnosed, of course, I think we're interested in diet. We've seen some results based on exercise. I do believe it raises the question of, is it weight loss that's actually the important factor here? Now, I would say the jury is still out on this, if it's the diet itself or the weight that patients lose. And I refer here to some studies that are led by Jonathan Wright out of the University of Washington in Seattle, first a pilot trial where they showed that yes, they can have prostate cancer patients lose weight. There were some interesting biomarker findings. And there's an ongoing randomized study where they're doing a weight loss specific intervention and looking at outcomes like glucose regulation and weight loss. So I really eagerly await these data because they'll really help inform this group, I think, as to if focusing on diet, focusing more heavily on weight loss is really more important. And finally, looking at advanced prostate cancer, there are a few factors I think it's important to consider. We mentioned statins a bit in terms of risk, but there's a growing body of literature that statin use is associated not only with a longer overall survival, like we've seen in the cardiovascular literature, but also a lower rate of dying of prostate cancer. These are two large studies in a well-known peer-reviewed journal. More recently, there was a secondary analysis of a randomized trial where patients had prostate cancer, received radiation, or were randomized to some systemic treatment. Now they looked at, they looked at those patients who were on statins and again showed that there was improvement in overall survival and in prostate cancer specific survival. So putting this all together, looking at diet, weight loss, perhaps statin use, what is it that's actually causing the possible benefit here in men with prostate cancer? And I think that's really the key question that we need to look at going forward. There are what I see as three major potential mechanisms through which all of these lifestyle factors can actually modify either the tumor or the area around the tumor. They can involve hormone signaling, metabolic function, or changes in these lower levels of chronic inflammation. And I think if we can identify these factors that are driving progression, then we can select patients. We can tell men, hey, this is specifically what's going on. Maybe you need weight loss, or you need to really focus on a plant-based diet. And I think that's the future of really personalizing some of these recommendations. And we're not there yet. And finally, I was hoping to get to this bonus content. I think that we have time. I call this some initial work in a path that I've started and my group has gone down that I think is kind of fascinating. And it involves coffee. I think you're probably all very familiar with coffee. It's nearly ubiquitous in our country. And people know that there are numerous health benefits. What may be less well known is that coffee can decrease the risk of being diagnosed with a number of cancers. And this is true in prostate cancer too. The data are not incredibly strong, but some epidemiologic data shows that increased coffee intake may lower diagnosis. Now, if you look at something like colon cancer, the data is actually a bit better. And this includes men who've been diagnosed with colon cancer that's a bit more advanced. Coffee intake appears to have some association with an improvement in their recurrence rates. Now, this had not been previously looked at in an active surveillance population. So what we hypothesized was that increased coffee intake may decrease the risk of progression over time. So we split men in our cohort into a number of groups based on the number of cups of coffee they drank per day based on a food frequency questionnaire. Of course, I would acknowledge there are some limitations to asking men of what their consumption has been like for the past month or 2 months. With some of the best data that we can gather, especially when we're looking back in time. Now, this figure shows our main findings with the really dark horizontal line showing that coffee would have no effect. So in essence, as you drink more coffee, maybe it's a bit protective, though it wasn't what we call statistically significant. So our main kind of takeaway here was, okay, don't tell men to stop drinking coffee. It seems safe, particularly in that kind of moderate 1 to 4 cup range per day. What I think makes it a bit more interesting is we decided to look at potential mechanisms of how coffee could help. And this is based on the idea of caffeine metabolism. And there's a single nucleotide variant, which really is just a gene that people have that is related to an enzyme that metabolizes caffeine. Now, everyone has 2 copies of this gene, and we call them alleles. So if you have 2 of the A alleles, you are a fast caffeine metabolizer. Oftentimes, people who are fast metabolizers kind of know that they are. They can drink coffee later in the day and not have trouble sleeping, or they may have just more coffee per day naturally. And of course, if you have the C allele, you're a slower metabolizer. So you could be an intermediate metabolizer with AC or a slow metabolizer with CC. And what prompted us to look at this was actually evidence from other disciplines. There's a study that showed that men who are at risk of actually it was men and women at risk of heart attack, who were fast metabolizers and drank coffee had a lower risk of heart attack. But that was not shown in those patients who were slower intermediate metabolizers. And interestingly, randomized data looking at athletic cyclists showed if they're a fast metabolizer who drinks caffeine, they had improved performance on a really standardized test. But if you were a slow metabolizer and drank caffeine, you actually did worse than if you had no coffee at all. So we hypothesized that men who drank coffee, who were diagnosed with prostate cancer, who were fast metabolizers, may have an improvement in their progression. And that's actually what we showed here, and albeit a limited study with some small numbers, but those patients who were fast metabolizers that drank anywhere from half a cup to 3 cups of coffee per day maybe had a lower risk of progression over time. And we did not see this in the intermediate or slow metabolizers. So I think this is interesting, but we decided to follow it up a bit. And actually, I can share with you some data that unfortunately are not quite published yet, but we're getting pretty close. That's kind of an odd slide. And we looked at really the largest consortium of men diagnosed with prostate cancer in the world, the Practical Consortium. And we took the subset of men who we had genotype data and also dietary data. And this is looking not just at low-risk men at risk of progression on surveillance. These are men at risk of dying of prostate cancer, which included some advanced patients. So looking at this entire population, among those men who were fast metabolizers and drank 2 or more cups of coffee per day, they had a lower risk of dying of prostate cancer over time. Now, I really encourage people not to get into the weeds as to the exact number of cups. These surveys are very limited, but I think the big takeaway here is there may be something here whereby if you're a fast metabolizer and you drink some coffee or maybe more coffee than others who are fast metabolizers, there's potential effect on prostate cancer related mortality. This is not advice to go out and start drinking coffee or drinking less coffee or finding your genes. I think this is an interesting sort of rabbit hole we've gone down now, and I'm happy to talk further. Now we have a grant from the American Institute of Cancer Research looking at potential mechanisms of this, and it's related to both compounds in coffee and in caffeine itself. So bringing this together, I think in terms of prostate cancer risk, it's clear that obesity, physical activity, and diet can be related to your risk of being diagnosed. For active surveillance, our data are not quite as strong, but we have strong suspicions that things like diet and exercise may offer benefit over the long term. And finally, in advanced disease, statins seem to have a particular effect. Maybe worth talking to someone's doctor about, particularly if they are having at risk of a cardiovascular event. And that's it.
Thank you so much, Dr. Gregg. That was such a great presentation. We appreciate it. Thank you all for listening and submitting your questions. Now we're going to get into our Q&A session, and we will have Dr. Loeb come back up to the virtual stage, so to speak. And our first question that came in is, what are your thoughts on melatonin supplements for sleep and prostate cancer patients?
Yeah, I mean, they're actually doing some reevaluation of melatonin supplements right now in the American Sleep Association. So I would say to stay tuned on that, because it is a reasonable option, and particularly, would be probably better than taking a hypnotic prescription sleeping medication in the long term. But some concerns were recently raised. So it is actually currently undergoing evaluation, and I would just wait and see what happens with that.
Thank you so much. And another question about sleep that came in, is THC a healthy sleep aid?
I mean, there's really not a lot of research on that, but it could potentially be helpful. I think if something is going to help relax you.
Okay, awesome. Thank you so much. What's the connection between sleep apnea and BPH?
Yeah, so that's a great question. So actually, sleep apnea causes nighttime urination. So some of the symptoms that people may think are from BPH could even be from sleep apnea. So definitely when people, tell me they're having a lot of nighttime urination, it's something that I ask about, is have they been assessed for sleep apnea? So yeah, sleep apnea can cause erectile dysfunction. It can cause urinary symptoms. So sleep apnea doesn't cause the prostate to grow, but it can cause some of the same symptoms as BPH.
Awesome. Thank you so much. We have a viewer who has gained 15 pounds on ADT, and they currently walk an hour a day. Any other recommendations on how this individual can lose weight?
Yeah, I mean, I think, the nutritional component is very important. And I showed a slide earlier about, that weight loss was achieved with people who did a Mediterranean or a whole foods plant-based diet. So I think, they say you can't outrun your fork, or six packs start in the kitchen, so even if you're doing a ton of exercise, if the nutritional component, and same with the sleep, not getting enough sleep is associated with obesity.
And when I'm in clinic, sorry to interrupt you, I do lean a lot on our dietitians. That's really their area of expertise. And if there's maybe it's a weight loss expert or just a dietitian with expertise in patients who have cancer and are dealing with some of those issues, I'd encourage you to see someone like that, because there are individual factors that they can really help and counsel on.
Great point. Great point. Our next question is about dairy. Dr. Loeb, you mentioned that dairy was harmful. Someone wants to know if you consider yogurt, non-fat yogurt, harmful?
I mean, definitely there's the strongest evidence is for whole fat dairy. So if you're eating any kind of like ice cream or other products that have whole milk, that would be the worst case scenario. But I think the best case option is to just avoid all dairy. But certainly non-fat yogurt would be the best choice if you had to pick something in the dairy category.
Okay. And what about fish? Eating fish once or twice a week, is that helpful or harmful in terms of prostate cancer progression, excuse me?
Well, I think that's really an area of conflict. I think it's definitely, I would say, by far the best choice of any animal protein option. So if you have to eat an animal protein at all, fish would be definitely better than chicken, eggs, definitely better than red or processed meat, and better than dairy. And fish does have some cardiovascular benefits. And so, with the Mediterranean dietary patterns that Dr. Gregg talked about, those are basically plant-based plus fish. So I think that is absolutely a viable option. There are some other concerns with fish. If you're eating farmed fish, then they're raised in these very crowded, dirty pools and given a lot of antibiotics. If you're eating fish that are from the ocean, there's a lot of microplastics now that are being found in the fish in the ocean. Some fish are very high in cholesterol. So you just have to watch for which fish you would be eating. And then, the environmental concerns just of overfishing and everything. But yes, of the animal category, I think it's the best. And maybe Dr. Gregg has some comments.
Yeah, I mean, I'm a fish proponent, but in moderation. I mean, I think even on a Mediterranean diet, you're not having fish every day. At most, to score well on our Mediterranean diet scores, it's 2 or 3 times a week. So, I think that, like Dr. Loeb mentioned, there's some really nice benefits. There's, eating certain fish has very high omega-3 amino acid or omega-3 fatty acids. And, I think if you're going to try to find individual diet components, you'll probably end up splitting hairs. I think the bigger picture of it's sort of the whole diet that you're having is probably the most important. And I think that even the meal study showed that, where we know that plants are good, but if you just increase your vegetables by 1 or 2 servings a day, it's probably not enough.
Awesome. Thank you so much for that. And we have a viewer who has no evidence of disease after prostatectomy. Do these recommendations apply to those patients as well?
For sure. Yeah, I think they apply to everyone, you know. I mean, first of all, like we said, you know, if you have a low risk prostate cancer or, you know, no recurrence, I mean, that's wonderful news. But now your greatest risk is dying from cardiovascular disease, which is a leading cause of death for all Americans. So it's never going to hurt anybody to make these changes. And it may have some benefit in terms of reducing the risk of the prostate cancer ever coming back. And for sure, it will have benefits for things like cardiovascular health, which, by the way, is basically the same as sexual health, because the same blood vessels in the heart are the blood vessels in the penis, and atherosclerotic and narrowing of blood vessels anywhere decreases the blood flow anywhere. So as far as I'm concerned, yes, yes, yes. Sleep, exercise, and nutrition are important, whether you're cured, whether you're in the advanced stage, at every point. Dr. Gregg, what do you think?
I mean, I completely agree. I mean, I talk to patients all the time, and they want to know about a Mediterranean diet, and I tell them at any stage, you know, maybe this is going to help your prostate cancer. We don't have that firm data or those firm data yet, but we know it helps your heart. And that's the threatening thing for so many men with prostate cancer. So I see no downside, like Dr. Loeb's awesome slide of doing a healthy diet. I mean, that's going to just help your life. And maybe we'll help prostate cancer too.
Yes, definitely. Okay, what is the microbiome, and can we use it in a dietary strategy to prevent prostate cancer?
I think it's a great question. So big picture, the microbiome, it's the catch-all word for all of, usually they're referring to the bacteria that live in your gut, your GI tract. And there's just increasing research and knowledge of, you know, people having different microbiomes and them having really a direct role in our health. And they're not simply bystanders that are involved in us getting our nutrients. They have signaling that can affect our bodies. They can actually impact even risk of malignancy. They can impact how treatment can affect a malignancy. And it's a very young field. And I think it's going to end up being almost a pillar of what we use in planning both dietary interventions and cancer treatment. And they're showing that now with some immunotherapy and other advanced cancers. But what I'd say is in prostate cancer, we're behind is not the word, but it hasn't been shown to have a clear sort of signature of different bacteria in the gut that are really predicting, you know, response to things like diet or risk of prostate tumors. Now, there's a small exception of actually a recent very nice paper of men with advanced prostate cancer, and men who are with advanced disease are often given a medicine to try to knock out their testosterone. And what they showed was that there were, you know, bacteria in the gut that when men started to become resistant to this medication, part of that was due to a certain bacteria that was growing and actually providing the androgens or providing the testosterone to these men. So I think it's just scratching the surface to what will be important here. So really to get back to your question, right now, yes, you could go and have a private company and tell you about your microbiome, but we don't have anything actionable with that. You know, I'll tell you, we're including in our studies, I have a Mediterranean diet-based intervention right now before prostate surgery, and we're focusing a lot on the microbiome as well, because I think that will be really important when we're considering the diet and really how the diet is working and actually affecting the prostate cancer.
Thank you so much for that awesome answer. Kind of along the same lines, what are your thoughts on flax seeds to help prevent or reverse prostate cancer?
Yeah.
I guess
Go ahead.
Sorry, Stacy. I sort of I'm not really aware of much literature on flaxseed specifically. I'd have to, you know, do a little reading, but I usually go back to when my patients ask about things like this is, you know, doing a single factor is probably not going to make a huge difference. I don't encourage someone to go take super high doses of any single thing or vitamin or supplement. I think it's more of the whole picture. So I wouldn't really hang my hat on a single thing like flaxseed.
Yeah, I'll jump in. I mean, I agree with your, overall statement that, yeah, I don't think that any single food or component without a whole dietary pattern is going to be enough to be like the miracle cure or something like that. That being said, I do think that ground flax seeds are helpful. I do consume that personally as part of the whole food plant-based diet, 1 tablespoon a day approximately. I usually put it in my oatmeal in the morning, and that gets in, some nice omega-3s, a very high fiber breakfast. So I think if you can work that in as part of a healthy dietary program, that there are some benefits. And if you do want more information on flax, this is certainly not my main area of expertise, but Dr. Gregg has a lot of the research summarized on flax seeds on the nutritionfacts.org website. So I would recommend looking there for summaries of all the research on flax.
Thank you so much for those comprehensive answers. So I want to kind of jump into, if both of you can give your perspective on alcohol and prostate cancer as well as sugar. Many times we hear that sugar feeds cancer. Can we get your thoughts on that? Dr. Gregg, we'll start with you.
Sure. Honestly, I've been sort of diving into this a lot recently, and what I'd say, sugar is complex, and I think there's one way to look at it of it's very, very straightforward. We kind of know added sugar is not good. That's not good for prostate cancer. That's not good for risk. It's not good for risk of progression. And almost every diet that's been shown to help cardiovascular risk or shown to lower risk of prostate cancer, it doesn't include a lot of added sugar. So I think that's a really key thing. If you're taking something away from this, yes, I don't think that you can just simply say sugar feeds prostate cancer, but it's not a part of what we'd recommend as a healthy diet for someone who's at risk or being diagnosed with prostate cancer. But I do think there's a lot that we're going to learn in the next 10 years related to how our body makes sugar and actually processes things and uses insulin to drive glucose in our bodies into our cells and potentially into tumors. So I think it'll end up being, there are other factors that relate to how our body, for example, how it makes fructose. This can be made based on dehydration or sodium intake. There are a lot of factors that can actually tell your body to start making sugar, even if you're not taking it in, a Coke or other soda. So I guess short answer would be yes, avoid sugar. Long answer is I think we're going to learn more pretty soon.
Dr. Loeb, anything to add to that? Sugar and alcohol?
Yeah, I mean, of course, eating a lot of sugar isn't good for anything. And, with the whole foods plant-based diet, the emphasis would be on whole grains rather than, sugars or refined carbohydrates. So it doesn't mean you have to give up all carbohydrates and fruit. Natural sugar is fine and healthy. So, to the extent possible, if you have a sweet tooth, I found I make an ice cream for myself. I use one of the plant milk substitutes. Many of them are calcium fortified. Some even contain higher levels of calcium than dairy. And I mix it with frozen bananas and sometimes also frozen mangoes in the blender. And it just makes a nice ice cream like dessert that's high in calcium and very sweet, but there's no added sugar. It's just the natural sugar from the fruit. Or dates, they're very tasty and have natural sugars. So if you have a sweet tooth and can get that sweet flavor from fruit sources, that would be better. Alcohol, there's really not a lot of data showing that to be particularly harmful for prostate cancer, actually. So I would just go with the general recommendations for Americans in this case, and one drink a day is completely fine. So I hope that's helpful.
Yes, this is great information. Have either of you heard or experienced that patients with prostate cancer changed their diet and lifestyle and it decreased or stopped the growth of their tumors?
Yeah, well, I mean, that's exactly what they found in Dean Ornish's study, where, these patients who did the program with the vegan diet, the moderate intensity physical activity, stress reduction, and supplements, that, their PSAs went down. And same within that UC San Diego study and the patients with PSA relapse, where the PSAs were decreasing. So, I don't think there's a magic bullet. It's not like you can automatically reverse or prevent any progression of cancer by diet or exercise, but, it may be possible to slow the growth. And regardless, you're helping, the heart and the rest of the body. So I would say maybe, because there are some intriguing findings from very small studies of small groups of people who made very significant dietary interventions. But just adding one supplement or changing one food is not going to do it. And even maximal dietary impact may not be enough, but it's certainly not going to hurt making your body healthier.
Okay. Does ejaculatory frequency contribute to higher prostate cancer issues?
Oh, I love this question.
Do you want to take it?
Sure. I have had a radio show on this several times. This is one of our more popular topics for the Men's Health Show. Dr. Jennifer Ryder published some studies showing that greater than 21 ejaculations a month were associated with a lower risk of prostate cancer. So if anything, cleaning out the pipes does seem to eliminate some of the, carcinogenic substances in the area potentially. Of course, these studies have recall bias. Asking a man how many times he ejaculated per month at different times in his life is certainly not rocket science or the most reliable information in the world. But, that being said, if you enjoy sexual activity and have safe sex practices, then there may be an added benefit for the prostate. What do you think, Dr. Gregg?
No, I mean, those are the data that I was going to refer to. I mean, it's all sort of epidemiologic data looking over a long period of time, but it's, at least mechanistically, it makes some sense. And, the data is only stronger as they look at, longer follow-up from that study. So I think, you can consider it.
Great, thank you so much. What are your thoughts on foods high in omega-3 versus omega-6? Should either be avoided?
I think it's beneficial. I mean, we've talked a bit about omega-3 with fish, and there's some evidence that omega-6 can be a pro-inflammatory, and we talked a bit about one of the possible mechanisms here whereby, food or microbiome or coffee could be affecting prostate cancers related to inflammation. And that's still kind of a hypothesis in some senses, but it is a possible reason why omega-3 could be beneficial. So I think it's potentially important, but more work to be done.
Awesome. Anything to add, Dr. Loeb?
No, I agree.
Okay. All right, next question for Dr. Gregg. Would metformin along with statins be a possible additional value?
Hard for me to answer. There's been some work on metformin in prostate cancer. Those data are not quite as strong. They've done some pre-surgical work as well. But as you probably know, many talk about metformin as if it's a medicine that can really improve longevity for all kinds of people. So I do think that we will learn more over time on metformin, but right now I would, talk to your doctor about the specific indications for metformin. If you have diabetes and they're looking to prescribe you for that, then yes, I think you would take it. And if you had other indications for statin, then yes, I would take it. I would not start either medicine just because of the data that Stacy and I showed you tonight. It has to be as part of a broader health clinic, because right now I'm not in clinic prescribing statins for my prostate cancer patients. We're still studying it.
Yes. And how do you know if you're a fast or slow metabolizer? What can you do to find out?
Yes, you can find out. All of the 23andMe and those, those sites that you can get your ancestry data, they look at these, they're called single nucleotide variants, and this is a very, well described one. It's on all those reports. So I say that, like, you can do it. You can find your metabolism type. You probably won't be surprised because you have an idea if you drink coffee after 2 p.m., if you can't sleep, you're probably not a fast metabolizer. But the thing I'd caution is please don't change your coffee intake right now based on what you see on 23andMe. I think it's this fascinating thing that we're diving into and even has potential mechanism behind it. But I'm in no way at a point where I can prescribe someone a coffee prescription to go with their, what I see in clinic.
But maybe one day, because that would be great.
Maybe one day. That'd be awesome.
Yes. Can you touch on the impact protein and tofu has on prostate cancer?
Yeah, so cultures where they eat more soy products have lower risks of prostate cancer and also some other cancers like breast cancer. So tofu would be a very good protein choice.
Anything to add, Dr. Gregg?
Oh, no, I defer to Dr. Loeb on all things plants.
Okay, awesome. What are your thoughts on brown sugar or honey? Is that okay in terms of sugar consumption?
I'm changing how I think this week. I'm reading a book called Nature Wants Us to Be Fat, and it's by a really awesome scientist named Rick Johnson. And I don't know, I'd refer everyone to that, and maybe we could put it in the notes or something. It's just he was really a proponent 8 or 9 years ago that it was added sugar to our diets that was really causing a ton of problems, including cancer diagnoses. And he's uncovered, since that time that he's actually said he may have been completely wrong in just prescribing that for everyone. And that there are certain foods, especially in people who maybe they're overweight or they've been primed with a lot of soft drinks and sugar intake, that taking in foods that are high in fructose can actually potentiate some of this, lack of sensitivity to insulin and even some of these problems that can be related to cancer risk. So I'm reevaluating how I think about honey right now, as odd as that sounds.
Yes, awesome. And I just want to kind of go into supplements. There's a few questions here about supplements. What are your recommendations, if any?
I don't recommend supplements to my patients. Maybe that's, I don't know. I don't know if everyone agrees with me on that type of approach, but I mean, there's large studies that have been done looking at high doses of certain supplements, things like selenium, and they've, been the complete opposite of what we thought that they would do. So I think that, kind of like when my kids ask for their vitamins all the time, I tell them your vitamins and your broccoli right there, that's what you got to be eating. So I tend to go more towards the foods.
Yeah, I think that's a very good point. Getting a lot of your vitamins from food. For plant-based diets, I recommend supplementing vitamin B12. That's very important if you're consuming a plant-based diet. So I take that every day, and vitamin D, because most people are, deficient for vitamin D. Those are the only 2 supplements that I personally take or, broadly recommend to people unless there's a specific nutritional consideration.
Okay, we have a question here about the growth and or metastasis of cancer correlated to the amount of amino acids, thiamine in diets. Any thoughts on that?
I'm not aware of data on that. I'd have to do a little more reading, but I imagine that's not like a mainstream thing yet. There may be some beginning studies looking at methionine.
Yeah, I mean, there are some studies on choline, which is found in eggs, and choline increasing the spread of prostate cancer. That's like I believe a derivative of serine. And then, just protein in general, eating too much protein is probably not a good thing. But, having the protein coming from plant sources is better than animal sources. There was this really interesting experimental study where they looked at animals and they looked at breast tumors and prostate tumors, and they just changed the feed in the mice. So they shifted it with the same amount of protein from 20% of a dairy-based animal protein to 20% plant protein, and the tumors shrunk by 37%. So I think that the protein quality and where the protein comes from does make a big difference.
Awesome. And we're going to start wrapping up, but a question is, where can a patient start first? Should it be diet? Should it be sleep? Should it be exercise? What's one step they can take today to really start optimizing their sleep, exercise, and diet?
You want to go first, Stacy?
Sure. I think whatever you feel you can do today is what you should do today. We're all starting out at a different place, and if you haven't been doing any exercise at all, then just doing a few minutes a day and building up over time. If meat or dairy are a big part of your diet, going cold turkey may be very difficult, but just slowly. I think adding things can be helpful before subtracting, so instead of saying like, I can't eat this anymore, what am I going to eat? Better to start by introducing some new foods, try experimenting with some things before deleting anything and see if you can find some new things that you like. And then sleep, baby steps. Can you do one new thing in the next few weeks? Maybe it's not looking at your phone in the middle of the night when you wake up. Maybe it's not drinking anything within 2 hours of bedtime. I think if we all just take very small steps forward and don't feel overwhelmed like you have to change your entire lifestyle overnight.
Yeah, I agree. I mean, I think the best evidence we have as to dietary adherence, and probably applies to these other factors too, is when it's least impactful to your life. So there are some out there that think if you're looking for weight loss, you're looking for diet change, there are a number of dietary options that are probably pretty good. But if it is sort of the least painful for you, that's probably the thing to look at doing, and that would really better predict that you can stick with it. And I would say I wouldn't look just at weight loss. I would look at the factors that can go to that. Start looking at your diet, evaluating what can be changed. Start walking. Everyone does it. If you start walking, that you're just beginning to grow your future aerobic engine, and you can add on more and more intensity or whatever it is you like to do. But start somewhere. So I think, again, I'm in line with Dr. Loeb.
Thank you so much, Dr. Loeb and Dr. Gregg, for such a great presentation. And we are going to wrap up. We are going to bring Rick Davis to the stage.
Well, boy, I've learned a huge amount, and I think a lot of other people have learned a huge amount. And I really want to thank Doctors Loeb and Gregg and Wendy Garvin Mayo for an outstanding presentation and a great question session. It was like rapid fire questions. I have to take Dr. Loeb's example. I mean, she talks the talk and she walks the walk. Here we have plant-based exerciser. Now, I do have to tell you that back in 1986, I quit eating meat. And I've been an endurance athlete since I was around 25 and still am. Unfortunately, it didn't stop me getting stage 3 prostate cancer in 2007 when I was 56. That said, I think Dr. Loeb's lifestyle is going to stop her getting prostate cancer. So, and I'm not actually being flippant. What I am saying is we can do all these things, and it may help our prostate cancer. It may not help our prostate cancer, but at the end of the day, we're going to live healthier and we're going to live longer. And I think if there's one take-home message for everybody who's listening, it's that this is what I like to call, people have heard me say that this is a chicken soup recipe. It certainly cannot hurt, and it's probably going to help. So if it's anything like my mother's chicken soup or Stacy's mother's chicken soup, I would say follow these recommendations because they are going to work. Just a couple of quick housekeeping things. There will be a recording. We will ask Dr. Loeb to give us the details for the study that she mentioned, and we'll include those contact details when we blog the recording. Usually takes us a few days, but it'll be out there, so you'll get all of that in the blog. I want to give a quick promo, and I've put it in a couple of times. We have a virtual art therapy class, which might not be quite as good as getting as much sleep as you'd like, but it's certainly going to help you relax and it's going to help your stress. By the way, I should tell you that the one benefit from my ADT was that it changed my sleeping habits. And instead of sleeping 6 to 7 hours, I now sleep 9 to 10 hours every night. And that was after I came off the ADT. So I don't know if that's ever been studied or if I'm unique. Oh, I should also say I'm a fast metabolizer of coffee, Dr. Gregg. So if you need a lab rat, man, I can drink coffee at midnight and it doesn't keep me up. So that means I have to have 2 of those alleles that are the same. The very last thing, I also should give a shout out to Howard Walensky, who without him, we could not have gathered these 2 great speakers, and also to our ANCAN team, who led by Alexa and Joe, who produced this. And lastly, I just want to thank again our sponsors who allow ANCAN to keep the door open, Bayer and Pfizer and Janssen and FMI and Myovant. I think that's everybody. And with that, I wish you all a good night and thank you for attending. Oh, one last thing. Tomorrow night, we have a BPH, very rarely discussed, but I'm sure Dr. Loeb will know Dr. Steve Kaplan. She probably knows him pretty well. And he is Dr. Prostate. He is the guru on BPH. Is that right, Dr. Loeb?
Absolutely. You should definitely come to his webinar.
And it'll be a drop-in in our Barniscus room tomorrow night. You don't have to sign up. And you're going to learn everything that you needed to learn about BPH, frequency, and urgency. And with that, I say, see you tomorrow night. Good night.
Hi, everyone.